We are breaking into your regularly scheduled program to bring you another breaking news alert. I'm Tom Shad. North Carolina Governor Roy Cooper is holding an update on the coronavirus pandemic. Let's listen.
60 people who have died. As the number of people lost to COVID increases and we draw closer to the holiday season, I know many North Carolinians are grieving right now, and I continue to think about them as we battle this virus. Today, Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, will present our state's key COVID-19 metrics. As she will outline, our trends have avoided spikes, but they remain stubbornly high, and that's troubling. Other states have experienced spikes that have jumped quickly on them and their hospitals, causing more sickness and death. To avoid that, we need to focus on bringing our numbers down. We know how to do it. Wear a mask, wash your hands, wait 6 feet apart. Thanks to the North Carolinians who are doing those things. If more of us will join, it can help our economy recover and save lives. Right now, I'd like to ask Dr. Cohen to present our data.
Thank you, Governor. Before we dive into the data, I want to give a shout out to all of the nurse practitioners out there, starting with my mom. It's National Nurse Practitioner Week, and our nurse practitioners are carrying a heavy weight on their shoulders as they've worked tirelessly to serve on the front lines of this pandemic. Let's honor our nurse practitioners by living up to the message they are sharing this year. COVID-19 may have started this fight, but together we will win it. Today, my reason for getting behind the mask is nurses. I love you, Mom. I also want to share some good news. While it is still early, we learned yesterday that one of the vaccines being developed has shown promising results. And the Food and Drug Administration granted emergency use authorization for a new antibody treatment for people at risk for developing severe COVID-19 disease. While the supply of this treatment will be limited at first, I'm very pleased with the progress of our scientific community and what they're doing to fight COVID. Okay, now let's dive into the data. As a reminder, every week we look at a combination of trend metrics: COVID-like syndromic cases, new cases, positive tests as a percentage of total tests, and hospitalizations. We also look at testing and tracing capacity along with supplies for PPE. In our first graph, we look at people who've come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism. The yellow line shows that the trend is going down but remains elevated. Next, we look at new cases. This first graph shows you the trajectory of new cases each day since we had our first case back in March. You can see the yellow line has gone up considerably in the last month, and we are experiencing a new peak. If we narrow in on the trajectory of cases from early September through today, you can see a clear picture of what's been happening. Overall, our cases are trending up, and this is concerning, particularly as we head into the holidays. Next, we'll look at the percent of tests that are positive. This graph also goes back to the beginning of September, and if you look at this yellow line, our percent of positive tests has remained fairly level since mid-October. However, it is now closer to 7% rather than the 5% we had been seeing back in September. We want this metric at 5% or below. On our next graph, we look at day-over-day hospitalizations. This graph also starts in early September, and the number has been relatively stable since mid-October, but you can see our hospitalizations are up since September, and overall are too high as we head into the winter months when hospitals have stretched capacity even in non-COVID years. It's a reminder, if you haven't gotten your flu shot, please do that as soon as possible. Okay, here's where we are. Surveillance data has been going down, but still above our baseline. It gets a yellow line. North Carolina's trajectory of cases is up, and it gets a red X. North Carolina's trajectory in percent of tests returning positive is level, but it's running higher than it was in September. This gets a yellow line. And North Carolina's trajectory of hospitalizations is high, but level. We still have capacity. This also gets a yellow line. Now to the capacity indicators. Our testing capacity is good. We're doing a high number of tests and making screening tests available ahead of Thanksgiving. This gets an upward arrow. On contact tracing, there have been more than 800 notifications of possible exposure to COVID-19 through Slow COVID NC. You can join the more than 345,000 people who have downloaded Slow COVID NC from Apple or Google Play Store. This metric gets a sideways arrow. Our PPE supplies remain stable and we continue to distribute PPE across the state. This indicator also gets a sideways arrow. Bottom line, we are on shaky ground as we head into Thanksgiving. The safest thing we can do for our loved ones is to limit travel and to avoid getting together in person, especially indoors. I know that's more easily said than done after so much time apart from our friends and family. So if you're going to travel or get together, plan ahead to reduce the risk to your family and friends. Think about getting a COVID-19 test 3 or 4 days ahead of time. A test can help you know if you have COVID-19, even if you have not had symptoms. If you do test positive for COVID, stay home and isolate. Because a test can miss some infections, and a negative test only gives you information for that moment in time, it's not a free pass. So you still need to wear your mask and practice all the 3 W's, including keeping 6 feet apart from each other and washing your hands often. Tests are available at state-funded community testing events. Other sites may offer tests for this purpose as well, so call ahead to find out. You can go to Find My Testing Place for a list of all community testing events and testing sites. Detailed guidance for traveling and gathering during the holidays is available on our website, including guidance for Black Friday shopping. Let's all keep our friends and family and loved ones safe this holiday season. Remember, it's not how well you know someone when it comes to wearing a mask. If they don't live with you, get behind the mask. Thank you.
Thank you, Dr. Cohen, and for your leadership. As you can see, these numbers are too high. Considering our trends and cooler weather driving events indoors, North Carolina will remain paused in our current phase 3, and we will adjust our indoor gathering limit down from 25 to 10 people. The science shows that the transmission of this virus is much greater indoors, and the more people who are gathered, the easier this virus can spread. We saw increasing spread from social gatherings in October. This reduction in our indoor gathering limit aims to slow the spread and bring down our numbers. It also sends a serious signal to families, friends, and neighbors across our state. Success in slowing the spread will help our businesses. In addition, we've been providing some direct help, and this week there will be some additional assistance for restaurants. Starting Thursday, full-service restaurants seeking help with rent payments or mortgage interest may apply to the North Carolina Department of Commerce for up to $20,000. As Dr. Cohen talked about, Thanksgiving is just 2 weeks away, and many North Carolinians are focused on how to celebrate the holiday amid the pandemic. There will be the usual concerns about who's carving the turkey and whether you're going to talk about politics. But we need everyone focused on how to keep safe this holiday season. And I want North Carolinians to keep something else in mind as plans come together. This pandemic will end. A vaccine is in the final stages of development, and the FDA has authorized a promising new treatment. Hope is on the horizon. This pandemic will not last forever. As frustrating and painful as it is, we must keep fighting a little while longer. We don't want to let the last 8 months of sacrifices go to the waste by dropping our guard or ignoring safety measures during family gatherings. We've come too far to lose our focus now. We don't want a spike in cases and deaths that will also hurt our economy. And even though this means changes to long-standing holiday traditions for many of us, take comfort in the fact that there is light at the end of the tunnel. With our continued dedication, by next Thanksgiving or even sooner, this pandemic can be behind us. We can put the sickness and the economic hurt in the rearview mirror if we pull together. That takes everybody committing to a safe holiday, even if it means changes this year. Reduce the invite list, space out your tables, get a COVID test before the event, or better yet, connect virtually. I know North Carolinians are creative and will find amazing ways to celebrate the holidays while still keeping our communities safe. Find a way that works for your family, and know that your sacrifice is helping all of our state. Also with me today is the Secretary of Public Safety, Eric Hooks, our Emergency Management Director, Mike Sprayberry. Monica McGee and Brian Tipton are our sign language interpreters. And behind the scenes, Jasmine Mativier and Javier Castillo are our Spanish language interpreters. We can now hear from our media, and if you'll state your name and your organization, we'll take the first question.
Our first question is from Sharon Van Zwieten with Spectrum.
You've been watching a news conference from Governor Roy Cooper on the coronavirus pandemic, and of course cases have been spiking in North Carolina. We've seen more than 2,000 cases a day average over the past 6 days, and that's come down a little bit to 1,500 cases. But the governor was concerned about the recent spike, saying that we could do better than this, and also recommended those getting together for Thanksgiving, if you're traveling out of state, to get a COVID test 3 to 4 days prior. And then, of course, if you do test positive for COVID, stay home. The big takeaway from this particular news conference was this. The Phase 3 limit of 25 people for indoor gathering has been adjusted down to 10 people in time for Thanksgiving. So that is one major takeaway that the governor wanted to get across during this news conference. As we're 2 weeks away from Thanksgiving, he says we can't stop now as far as trying to arrest this pandemic. We'll have much more coming up on Wavy News 10 beginning at 4 o'clock. And for now, we'll return you to Wendy.